Depends on your schedule. I don't want you to have so pack of exam also. If you have any other exam that you should focus on, then it's up to you. Just discuss with your course rep. Okay? That's for test 2. And then I think that's all. Last week was Prof has lecture. Hopefully it went well. I have uploaded the notes in Putra Blast. Okay. For Prof lecture, it's gonna be in final, not in test 2. Okay. Then let's proceed with the lecture. Do you have any question before I proceed? If there is
Doctor,
none,
I have a
yes.
question about the poster assignment. For the
Mm-hmm.
sizing, is it we must follow the 18 inches and 24 inches, or is it okay to be just portrait?
Is there instruction in there? I forgot also lah. Ada kan?
Ada.
Just follow that one. You mean like portrait or landscape, is it?
No, sebab ada dia doktor ada letak sizing has to be 18 inches width and by 24 inches height. Do we have to follow strictly or just letak buat portrait je?
There is basically a guideline because I don't want you to do in A4. Okay, if your poster is like too good or something, I want to print it out and put in my room or something, then it will pecah-pecah. So that's why I put a big size, inches like that. You can fix the inches in the whatever program you use, like PowerPoint or Adobe or something. But it's up to you lah, as long as not too big or not too small lah. Okay, if I zoom in, I don't want it to pecah-pecah and all the pictures should be clear. Okay, I'm not that strict on that thing also lah.
Okay, got it.
Okay.
Thank you.
And then don't copy your senior or something because I check one by one. It's automatic 0. Okay. Anything else? If there is none, let's see. Screen to share. Okay, last week we had a lecture on what do you call it? Coccidiosis. We are still under enteric diseases. Okay, now we are going to finish the enteric diseases, I think. Okay, so there are few more diseases that you should you should know. Especially the necrotic enteritis, ulcerative enteritis, and infectious vessel disease. Yersiniosis and rotavirus is not that common. Okay, it's not that common. Probably not common in Malaysia lah, but it's part of like it's a well-known disease. Okay, you may have not seen it in the future also, but in the differential diagnosis you have to consider it. Okay, number 1 is necrotic enteritis. It's an acute it causes acute enterotoxemia. Is caused by a bacteria that can produce toxin. It leads to sudden onset and high mortality. And the mortality, it depends on the severity of the disease also lah. How bad is the chicken also, the host immune system and whatnot. Okay, because necrotic enteritis, the agent itself is ubiquitous and is sort of like I call it normal flora, normal inhabitants of the intestine. Okay, you may isolate it in normal chicken also. Okay, it leads to confluent necrosis in the small intestinal mucosa. 2 to 12 week old birds are usually seen having this problem, and was first described by Parrish in 1961. That one is not important. The etiology is Clostridium perfringens. Okay, the Clostridium perfringens have A to E. Okay, they are classified based on the toxotypes, based on the toxin that they produce. However, in chickens, okay, in poultry, the type A is the most common one, and the type C can also causing issue. So type A and type C are the ones that are causing problem in poultry. Okay, it's a gram-positive rod, a non-spore forming bacteria. They are highly associated with high energy feeds in broilers, probably complex of even including subclinical coccidiosis and Clostridium species, and due to gut stasis. Okay, there are few factors that can lead to increase. Like I said just now, the bacteria is a normal inhabitant or normal flora of the gut. However, there are certain conditions. There's certain condition in the host. Number one is gut stasis, where the peristalsis of the gut is slower. Okay, it's not due to some nutritional issue or something, and then the gut stasis is slower. It leads to the proliferation. Is they cannot clear up. Okay. Secondly is when there are mucosal damage due to anything. Mucosal damage to the mucosa due to salmonella or coccidiosis or hemorrhagic enteritis or anything. And then the conditions is suitable for the Clostridium to proliferate. Okay. The cause of disease, if untreated, it can long last for several weeks, and after treatment, usually they decrease within 24 to 48 hours. It may reoccur in one grow out. It depends on the host condition. Okay. The mortality, if untreated, maybe up to 20%. If treated early, usually it's quite less than 2%. Methods of spread is probably by human or maybe normal soil organism that has flourished in the build-up litter, and it might reoccur in infected houses or in the farm if you have that problem before. Okay, if you have that problem in the farm before, the bacteria probably there, and then the new batch probably having it in the gut as normal flora and something. And then once you have immunosuppressive event like rainy season, not enough food, too hot, too high, what call it, stocking density, and then it might reoccur in the house. The clinical signs is quite general. You'll see depression and ataxia and diarrhea, immortality 2 to 20%, and usually seen the first 3 weeks of age. Okay, this is sort of like the pathogenesis. Okay, it goes inside the intestine. Okay, they grow on the mucosa, and then these bacteria have this gene called NETB. Okay, they can cause pore. Okay, lubang, pore forming compound on the gut, causing the leakage of the fluids. Okay, Clostridia grow into the small intestine producing toxin. Intestinal cells are destroyed, causing the liver damage, absorption and impact, and inadequate feed absorption. Okay, so that's what happened in case of necrotic enteritis. Postmortem lesions. You'll see the chickens are extremely dehydrated because of loss of fluids. Okay, darkened and dehydrated breasts. That's how dehydrated chicken look like. Dark congested liver, swollen because this Clostridium can also grow in the liver as well. Mild and lower small intestine have cooked appearance, balloon, friable, foul, smelling brown fluids. Dia macam, cakap macam mana? Dia tahi tu soup jugalah, okay. And then it's like cooked appearance. How do I say it? It's like diphtheritic membrane. I'll show you picture later on. Okay, mucosa looks like dirty turkey towel. That's the name, the appearance. They call it dirty turkey towel. So this one, this is also then this severe. They have we do scoring usually. Okay, you can see from the outside, you can see the mucosa doesn't look good with hemorrhagic and congestion, and then the inside one, the mucosa is thickened. Okay, and then all this necrosis. This is the appearance of the turkey towel. It's as if like they are sloughing off. The mucosa are sloughing off from the intestine. Okay, this one is not so severe. This is much more severe. Okay, and the diagnosis is based on the gross lesion and history. Mucosal scraping. You can also scrape the mucosa if you see these kind of things, and then look under the microscope. Is a gram-positive rods. If you do histology, you'll see coagulative necrosis, and then you might see also coccidiosis. Okay, usually is together with coccidiosis. And if you want to culture it, make sure you have to inform the bacteriologist. You want to culture specifically for Clostridium perfringens because they need to culture anaerobically. Okay, because it's an anaerobic bacteria. For treatment, you can treat in drinking water. Use antibiotic, bacitracin, penstret, or penicillin, azithromycin. This is some of the options of the treatments for necrotic enteritis. And then you also can do a small prevention by low continuous level of antibiotic, bacitracin, lincomycin, or virginiamycin in the monensin to have some effect against necrotic enteritis as well. Monensin is mainly for coccidia, but it have some effect to reduce the severity of necrotic enteritis and killing the bacteria as well. Disease must reduce in occurrence since combined monensin become a commonly used coccidiostat. Honestly, for necrotic enteritis, I've seen a few times, and usually it happens like post coccidiosis event. Okay, usually the chicken usually have coccidiosis first, and then was not treated early enough or something like that, and then later on you'll see the stage of necrotic enteritis occurring in the farm. I've seen this in some backyard flocks and some broilers as well. Okay, panasnya. Okay,
Hi,
next one.
Doctor.
Yes.
Sorry to interrupt, but we can't see your cursor.
Oh, sorry, I keep using wrong cursor on the screen. Sorry. Okay, this one. Okay, next one is ulcerative enteritis. Okay, next. Ulcerative enteritis is quite similar to necrotic enteritis, has been a limiting disease to the commercial quill industry. However, it's usually affecting the quill. Okay. Occurs in ground raised birds on the floor, occasionally seen in chickens, turkeys, and pigeons. Sometimes, okay, you can also see in chickens, but most of the time, ulcerative enteritis is a quill issue. It can cause acute and chronic enteritis. The etiology is Clostridium collinum. Okay, just now necrotic enteritis is Clostridium perfringens. Okay, and ulcerative enteritis is Clostridium collinum. It's a spore-forming anaerobic gram-positive rods. In chickens, when it happens, it's due to a combination of Clostridium collinum as an intestinal stress such as coccidiosis, salmonella, hemorrhagic enteritis, or any other disease that causing issue with the intestine. Quails usually on the ground or on the contaminated wire floor. I'm not sure whether you have been to quail farm. Okay, in quail farm usually they keep quail sometimes in deep litter system on the ground, or sometimes they put in the wire cages. Dia macam yang layer birds tu. Tapi wire cage dia kecil-kecil lah sebab dia quail kan. There's one big farm in Melaka if not mistaken. Apa tah nama dia? Puyomas. Puyomas or something like that. Okay, if you want to go to quail LI. Usually a secondary infection to Emeria brunetti, Emeria tenella, or Emeria nicatrix in chickens. Ulcerative enteritis seldom seen in broilers because of the good coccidiosis program. Coccidiostat, like I said just now, monensin might reduce the occurrence of this disease. Incubation period, the quail, is if it's in quail, is as fast as 18 hours, usually 1 to 3 days. In chickens, 48 hours after inoculation with ulcerative enteritis in birds previously infected with coccidiosis for 6 days. Usually seen in chickens about 1 to 2 weeks after the cocci breaks. Usually it's very similar, pretty much similar with necrotic enteritis. Is post coccidia outbreak. Okay, after 1 or 2 weeks, the condition of the intestine is suitable for this Clostridium to grow, and then you have another outbreak. The cause of disease in quails, about 2 to 3 weeks, acute may become chronic and have birds dying over long periods of times. And in chickens, 2 to 3 weeks, not as severe as quail, it is quite acute. In mortality in quail can go up to 100% because in quails, they produce a much more severe disease. In chickens, seldom over 10%. And usually they just recover by themselves as well. Okay. Method of spreads may be normal grounds bacteria that bursts up, probably some carrier birds bringing into the farm, carried over infected grounds and equipment, they berak, and then kawan dia makan, and spore continues to infect for years. Clinical signs, quails seen first in 6 to 10 weeks old birds. They develop diarrhea, sudden mortality in heavy birds, and infected diarrhea birds appear thirsty. It's very much similar with necrotic enteritis and can become chronic and birds become emaciated. Any age can be affected. Usually seen in birds raised on the ground and sometimes those raised on the in cages. Mortality, it depends on the severity. What is the dose of infecting bacteria? If the dose is very high, the immunosuppression is also very high, with any other factors add on to it, mortality can be up to 100%. In chickens, often occurs following a coccidia outbreak. Typically, they look like typically sick bird lah, ruffled feather, dehydrated, macam duduk macam tu. Birds develop diarrhea, watery, mortality less than 10%, and the birds appear thirsty. In quails, they're usually first seen in heavy fat birds. Feet may be present in the crop, yellow necrotic areas in the liver, and maybe hemorrhagic infarcts in the liver and diffuse focal necrosis. You have to understand both of these bacteria. This is not just GIT issue. They can also grow in the liver. And sometimes in the liver, also some white spots in the liver as well. Ulcer in the small intestines and ceca, punctate hemorrhages, large ulcers, yellow diphtheritic membrane. In comparison with necrotic enteritis, they are more generalized in nature. Okay, ulcerative enteritis develops ulcer. Dia macam button ulcer along the intestine. Okay, the ulcer might also perforate, and the content of the intestine may leak into the peritoneal cavity and leads to peritonitis. Birds that live more than 10 days usually become emaciated, and per acute cases may see liver lesions without gut lesions. Postmortem lesions in chickens are quite similar in quails. Okay, this is how they look like. Dekat luar ni boleh nampak dia punya ulcer-ulcer ni. If you open the intestine, okay, this is how the ulcer look like. Okay, along the intestine you'll see ulcers. Okay, this one boleh berlubang lah. Okay, and the liver as well. Okay, the liver as well can become yellowish and infected with bacteria. You'll see ni biji-biji ni semua ni. Okay, discoloration of the liver. Okay, they can also grow in the liver. For diagnosis, okay, lesions are quite unique. Dia selalu kalau you buka tu nampak ulcer button macam ni, there's only two possible options. Okay, number one is salmonella. Number two is ulcerative enteritis. Salmonella can also cause this kind of button ulcer look. You may have to differentiate from necrotic enteritis in chicken. If it happens in chickens, you have to make sure that it's not necrotic enteritis. Because sometimes in chicken they look almost similar. Quails are the biological indication. If you open a quail, have diarrhea issue, and you open the chicken and the quail, and then you see this button, yeah, there's for sure is ulcerative enteritis. Without even like doing culture or anything, that should be your tentative diagnosis already. Liver, spleen, and blood smear will show you the typical organism of the rot organism. Treatment, okay. Treatment, you can give bacitracin in the feed or in the water, and same as well is in chickens, is the same. Okay, you can also give pen strap into the feed or water. And then for the prevention, for quails, when birds are raised or held on the ground or exposed to a contaminated environment, you can use bacitracin at 50 to 100 grams per ton in the feed continuously. In chickens, bacitracin 50 to 100 grams per ton of feeds continuously. Also, low level of lincomycin or virginomycin can also prevent development of growth of the bacteria. Okay, it's continuous use of this one, bacitracin in the feed. Okay, that's all for necrotic enteritis and ulcerative enteritis. Okay, let's proceed with ricinosis, which is quite uncommon. Okay, it's reported in men, but not an important zoonosis. You have to understand also, in human, we have Yersinia pestis. Have you heard of Yersinia pestis? Pernah dengar tak? Kau tak pernah dengar? Yersinia pestis, black plague. Really? You don't know Yersinia pestis in human? Tikus. Air kencing tikus. Tapi air kencing tikus lain, lepto. Okay. Yersinia pestis cause plague back then, causing mortality about, if I'm not mistaken, killing 1/3 of human population. Let me see. Let me read. Yersinia pestis, the natural history of plague. In America, Africa is within environment, blah, 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 blah. Korang ni, during pandemik ni, rajin-rajin lah baca. Black plague. Bubonic plague. It's a bubonic plague. Yeah, bubonic plague. Which spread by flea or rodents in other humans are bitten by flea, blah, blah, blah. Berapa orang? Death 75 juta. 200 juta. If not mistaken, like a big chunk of human population died due to Yersinia pestis back then. But like I'm telling you, that is not the same bacteria. Okay, this one is Yersinia pseudo tuberculosis. Okay, okay, it was characterized by an acute septicemia of short duration, followed by chronic focal infection, causing caseous nodules. The etiology of yersiniosis in chickens is Yersinia pseudotuberculosis. It's a gram-negative frost, slightly acid-fast, positive with Zell-Nielsen stain. Okay. Transmission is contaminated food, water, and soil, and also breaks in the skin. The clinical signs, they can die suddenly without clinical signs or acute septicemia. In chronic cases, they become weak, dull, difficult in breathing, difficulty in walking, and persistent diarrhea. Postmortem lesions, in acute form, you'll see liver and spleen become enlarged. In chronic form, liver, spleen, lungs, and muscle show miliary necrotic foci, macam TB macam tu. Okay, catarrhal to hemorrhagic enteritis, and in some cases, osteomyelitis. So this is how they look like. That's why they call pseudotuberculosis, because the lesions looks like tuberculosis. All the nodules in the liver and the spleen. Okay. For diagnosis, you just need to isolate it, isolation and identification of an organism. In acute form, usually because this is a septicemic issue, you take from the blood. In chronic form, you can take from the lesion. For example, you isolate from the liver or from the spleen to isolate the bacteria. Treatment and prevention, chloramphenicol and streptomycin, tetracycline, and good management procedures. Okay. To be honest, this is not a very important disease lah. Okay, but if you have seen something nodule like that in chickens or something, please include in the differential. Okay, your differential should be broad. If you want to be a good vet, make sure you have an exhaustive list of differential. You did not exclude anything. All possibilities is there. Okay, because sometimes if you too narrow on certain thing, nampak ni terus, okay, ni macam ni macam ni. Okay, you always make a wrong judgment. Because just because something is uncommon doesn't mean it cannot happen. Okay, that's my advice lah. And next one is rotavirus infection. Rotavirus infection infects many species of domesticated birds, frequently associated with outbreaks of diarrhea. In chickens, ada benda berlaku, and then it can also happen in pet birds also. Rotavirus is quite common in pet birds as well. Etiology is rotavirus under the family of Rheoviridae. There are A to D serotypes. The transmission is through horizontal transmission, excretion in the feces and fecal oral route. No evidence of the carrier state. In human also, rotavirus is quite common. Especially kalau baby, budak-budak kecil yang selalu diarrhea apa semua tu, even in human, kalau you dapat diarrhea, there are possibility you get rotavirus also. Okay, but if I'm not mistaken, the period is quite short lah. You got persistent diarrhea for a few days or something, and then after that you recover. It's like normal virus. Clinical signs, watery droppings, depressions, anorexia, dehydration, and mortality can go up to as high as 30 to 50%. Postmortem lesions, intestine will be seen dilated, yellowish watery content with gas bubbles, abnormal amount of fluids and gas in the intestine and cecal. Carcass are dehydrated due to loss of fluids and inflamed vents because of apa tu? Persistent diarrhea. Macam manusia lah, if you have like diarrhea for days and you probably have inflamed vents also. Okay. Anemia is common, little in gizzards, and inflammation and crustration with dropping on plata surfaces of the feet. This is just indication of the diarrhea lah. Okay, when you have too much diarrhea, and then so basically the chickens are walking on watery surfaces. One of the sign of diarrhea, if you see your chicken have diarrhea or not, you look at the droppings at the floor. Okay, how wet is the floor? Kalau you berjalan tu melekat-lekat air tu, so many chickens, your chicken has severe diarrhea. Okay, those are indications of diarrhea if you go to a farm. The diagnosis, you can isolate this virus in chicken embryo liver, CEL, and chicken embryo kidney, CEK. Okay, you can also do immunofluorescence staining, histology of the small intestine, histology section. You can see basal vacuolation of enterocyte in small intestine, and can also do EM, okay, electron microscopy. I don't think we have PCR. I mean, we do have PCR for rotavirus, but not in Malaysia. It's not being offered in any lab in Malaysia for rotavirus. Not in IBS, not in UPM, not in the private also. Let me see the list. Yeah, they don't have it. You might want to send a sample to oversee if you want to do PCR, because we have not established PCR technique here in Malaysia because it's very not common. Okay, but you can do virus isolation. Chicken bari liver and chicken bari kidney is quite easy to do. Control, use fresh litter for each batch of birds. And problem with vaccine development, there are so many serogroup. Like I said just now, they're A to D. Okay. So you might want to choose which serogroup are endemic in the region. So vaccine development is not so. Plus, since it's not common, and there's so many serotypes, and then nobody vaccinate against rotavirus. Not in chicken lah. In human, if I'm not mistaken, ada vaksin untuk rotavirus. Okay. That's all for rotavirus. And the last one, okay, this one is the most important out of like all the topics just now. Okay, infectious bursal disease. This is one of the must vaccine chicken. Okay, must vaccine list of disease in any chickens, in broiler, layer, or breeder. Okay, because it's too common. It's an acute, highly contagious infection. A disease that affects young chickens, cause severe immunosuppression, carcass condemnation, and mortality. Can cause subclinical or clinical cases of infectious bursal disease. They affect B cells. So the virus replicates in B cells in the lymphoid tissue, which is the cloaca. It can cause atrophy of the cloaca. IBD, kalau you tengok nota ni, nota font ni pun tahu ni. Nota font siapa ni? Ni Prof. Hair punya nota ni. Kalau you compare dengan minggu lepas punya nota, ada Prof. Hair suka guna font ni. Okay, IBD is one of the most important highly contagious virus disease of chickens. IBD virus is an icosahedral non-enveloped double-stranded RNA virus. IBDV targets and destroy the bursa of Fabricius. This is more introduction. The economic losses due to high mortality can be up to 100% if you are infected with virulent, okay, IBDV. And they are also called chicken AIDS. Okay, they can lead to severe immunosuppression because they can cause full destruction of the bursa. Bursa is the primary organ for the production of B cells. If you don't have B cells, you cannot produce humoral immunity. Okay, so that's why we call it chicken AIDS. Okay, this is just a bit of revision before lah. Okay, this is a primarily lymphoid organ in chickens, thymus, and bursa fabricius. Bursa fabricius responsible for the B cells. Thymus is responsible for the T cells. And then we also have secondary lymphoid organs, Hadrian gland, bulk, gall, spleen, and lymphoid aggregates in organs. And then this is some picture. This is a normal bursa. This is how bursa look like. Bursa is located at the cloaca area. Kalau you buka dekat barrier bontot tu, angkat sikit bontot dia dekat dalam tu, dia ada like a sack. If you open this bursa, it's like it's like a sack like this. If you cut the sack, and then they are fold, you see the fold. They have a fold like this inside the sack. Okay, dia terbuka macam tu. Okay, this is the bursa that are infected with the infectious bursal disease. They turn yellowish jelly-like covering on top of the bursa, as well as hemorrhages and congestion. The etiology is AV virus. AV stands for birds, avian. In fact, it's birds. Birna is bi-RNA. Okay, segmented double-stranded RNA virus. So it's bi-RNA virus. So AV virus. So it's under the family Birnaviridae. It's resistant to disinfectant because there are no envelope. Yang IBD, kalau saya buat research pun sangat leceh. Okay. Sebab kalau saya buat research and then I infect chicken with IBD and the next research, I have to make sure that the room is really, really clean. Okay. Really, really clean. Sebab banyak kali kalau previous research was infectious bursal disease and the next research also get infected with IBD. They are highly resistant. There are few strains of IBDV. Okay, there are serotype 1 and serotype 2. Serotype 1 is very can be divided into several groups. Okay, subserotype. The very virulent IBDV, classical virulent. Okay, classical virulent, attenuated or vaccine strains, and the variant IBDV. Okay, the one causing issue is usually the very virulent. Nowadays, the variant is causing become predominant in Malaysia as well recently in the last few years. Okay, this is IBDV strain. So for classical virulent strain, classical IBDV, the mortality up to 50% is SPF chickens and 1 to 2% in commercial chickens. The infections in less than 3 weeks of age can cause immunosuppressions. In very virulent strain, for those infected with very virulent strains, VV-IBDV, mortality can go as high as 100% in SPF chickens. You know SPF chickens, right? What is SPF chickens? Anybody? What is
Specific
SPF?
pathogen free, right?
Specific pathogens free. So what does it mean? What does it mean? Specific pathogen free. So they don't have the pathogen. So it means the mother or all the parents were bred in a condition where they are full hygiene, they are not vaccinated against this specific pathogen, selected pathogen, and then they don't have maternal antibody. Okay, they don't have maternal antibody. So anak-anak tu semua tu tak ada maternal antibody apa semua lah. Okay, against specific pathogen. And so in those infected is very virulent strain, mortality is up to 100% in SPF chickens and 20 to 25% in broilers and 50 to 60% in layers. Infection of all ages and can cause immunosuppressions. And then the next one is the variant IBDV. Usually mortality less than 5% or absent. Infection at all ages and can also cause immunosuppression. IBD outbreak. Okay, let's talk about the history of IBD outbreak a little bit. Classical virulent strain, classical IBDV, was first found in 1957 in Gamboro, Delaware, USA. That's why the disease is also called Gamboro disease. Okay, like macam Newcastle disease lah, was first macam, and then this disease also called Gamboro. Kalau you pergi ladang kata, oh kena Gamboro ni, they are infected with Gamboro, then you know this IBDV. Okay, Gamboro is IBDV. And around 1980s, okay, the very virulent strains become predominant. Okay, infecting Europe's, and in 1990s, they come to Malaysia, including Malaysia. Okay, at that time, do you know the history of Prof. Hair? Prof. Hair PhD was in ruminants actually. he started, if I'm not mistaken, in ruminants, and then his interest was basically in ruminants and whatnot lah. And then in 1990s, he just finished his PhD, came back to Malaysia, and our IBD become an issue back then. Okay, become an issue back then. So he start interested in poultry diseases and whatnot, starting with IBD lah. Okay, so that's why Prof Hair is the big names when it comes to IBDV in Malaysia and in the world as well. Okay, so he has developed vaccines apa semua tu. So it's very fortunate event for him lah. Okay, back then. Okay, because it was just started in Malaysia, so IBDV had a lot of fundings back then because it causing a lot of issues all over Malaysia. A lot of pharmaceutical company funding and whatnot. So it's big opportunity for Prof back then. So that's why he's interested in poultry after that, if I'm not mistaken. Okay. Saya pun tengah tunggu outbreak besar-besar ni. Okay. And then Prof if I'm not mistaken, he also have developed vaccines. Ada kot dalam lecture, dalam notes nanti. Okay, he also have developed vaccines against IBD also. Using Malaysia strain. Prof millionaire and still single. Okay, gadis-gadis kat luar sana. And then we also have the last one is variant strains, variant IBDV in 1980s in USA, and now also in Malaysia have become predominant. In Malaysia, since 1991, only VV-IBDV was isolated, and other strains was since 19. Okay, this one is a bit outdated lah. Okay, nowadays, since 1991, only VV-IBD was isolated. Now, variant IBDV has been starting to be isolated also. Okay, we also have atypical VV-IBDV strain, Kong et al. In 2001. Transmission is through lateral transmission, persistent in the environment, contaminated feed and water, mealworms from contaminated environments, rodents, wild birds, and insects can be the vector and carriers for this. Okay. Long persistent survival of IBD virus in poultry house is due to unused infected houses. Unused infected houses were still infective for susceptible chickens 54 to 122 days later. Like I said just now, this virus is a non-enveloped virus. So they are highly resistant. You biar rumah kosong lama pun, so the virus can still be there in the house. So you have to really clear the house, disinfect the house. Water, feed, and droppings taken from infected pens were infectious even after 52 days. The clinical signs. Okay, like I said just now, there are two types, clinical and subclinical. In the clinical forms, usually around 3 to 7 weeks old, they show ruffled feather, vein picking. Vein picking sebab the bursa is, like I said just now, bursa is located at the cloaca. Okay, and the bursa becomes swollen. It irritates the area, the butt, the vein area, so the chicken will pack their own vein. Okay. The diarrhea, you will see this disease can also cause diarrhea, whitish or watery diarrhea, soil vents or feathers at the butt area, the basah-basah tu, tremblings due to dehydration and weakness, and severe prostration and death when they are too weak lah, due to number one is disease, immunosuppression, number two is due to diarrhea, and then dehydrations. In subclinical cases, less than 3 weeks old, if they are infected less than 3 weeks old, there are no clinical signs. Permanent damage to the bursa and thymus, they become immunosuppressive, poor response to vaccination, and less resistance to disease. You'll see bursa atrophy around 8 days post-infection, those infected with less than 3 weeks old. Those infected with very virulent IBD, they are more acute form, usually around 3 to 12 weeks old chickens, leads to short incubation period, sudden onset or acute sudden death. Suddenly, ramai-ramai je mati. Rapid flock recovery. Dia mati ramai-ramai. And then, yang hidup-hidup. Okay, habis. Settle. Okay, dia mati-mati. So, this is how they look like. Ruffled feather. They just look weak in general. They're sitting down. Okay. Postmortem lesions for clinical IBD, swollen bursa in within 2 to 3 days post-infections. Hemorrhagic bursa, yellow gelatinous covering around the bursa. And after that, leads to bursa atrophy, 5 days post-infection and onward. Small hemorrhages of the leg, breast, and the muscle. This is one of the disease that can cause hemorrhages on the muscle. Ada beberapa disease je. Kalau if I ask you what are the differential for hemorrhages on the leg, on the muscle, or if I show you picture hemorrhages on the muscle, there are only few diseases. Infectious bursal disease, chicken infectious anemia, and leukocytosis. Tapi yang dua lagi tu saya ajar kemudian lah. Okay. Swollen kidneys with urates because of the bursa enlargement, it blocks the ureter. So urates tak boleh keluar. So kidney becomes swollen. Hemorrhagic spleen, lymphoid tissue become blueberry spleen. The spleen tu patutnya warna merah kan, lepas tu dia jadi hitam. So they call blueberry spleen. Okay, this is an example of the hemorrhages of the muscle. On the thigh muscle, on the breast muscle can also happen. This is the thigh muscle. Okay, if you see a lot of chicken with hemorrhages on the thigh muscle, it should be your differential IBD. And then this is the bursa, enlarged hemorrhagic bursa. Okay, kidney yang ni tak swollen sangat. Okay, this is bursa. Congested hemorrhages. This one is yellow gelatinous covering. Okay, for the yellow gelatinous covering is you won't always see, but most common is just hemorrhages. Yellow gelatinous covering sometimes you'll see. If you don't see, doesn't mean they don't have IBD. Okay, so again, congested bursa. Yang ni pun macam enlarged sikit. Nampak tak? Dia punya urates tu, nampak macam otak lah sini tu. The kidney. Okay, usually in normal kidney, you don't see the groove, the glomerulus like this. Okay, yang if it's filled like this, you can see the urates inside the glomerulus. Okay, and then again, this is the bursa. Okay, ni swollen kidney, you can show you again. The kidney filled with urates dalam glomerulus dia ni. Okay, kalau tak nampak tu maksudnya kidney tu normal. Selalunya kidney is usually flat on the back like that. If it's enlarged, they out of the space, they engorge. And then bursa, this one is much more severe, it's necrotic and some hemorrhages. Okay, and also one of the thing quite common is hemorrhages of the junction of ventriculus and gizzard. I have taught you before, even in your test also, hemorrhages of junction of ventriculus and gizzard can also occur in the ND and AI. And then some other diseases lah, but they are more common in these three diseases. AI, ND, and infectious bursal disease. If you see hemorrhages here, okay, these three should be on your top differential diagnosis. This is how bursa look like under histology. Normal bursa look like under histology. Okay, follicles. Dia patutnya besar-besar macam ni tak? Oh, this is follicles. This is the bursa follicles. They have cortex and medulla. Okay, and the intramedullary space, intrafollicular space, they call it intrafollicular space, should be very narrow. Okay, very narrow in between the follicles. Okay, what happened when you are infected? This one also still normal bursa, cortex and medulla. Okay, interfollicular space is very narrow. Okay, means like this is a normal one. However, when they have become infected, you can see the atrophy of the follicle. Atrophy of the follicle, yang ni terus necrosis ni, dah tak ada hilang dah semua dia. Degeneration, inflammation and edema. Ataupun macam ni. Okay, you'll see like this. In comparison with the normal just now, you see a lot of spaces here. And then the cortex and medulla, you see all the empty space here because of the destruction of the bursa. All of this. Okay, degeneration. So, ada banyak lagi gambar bursa. Tu ni just some example lah. Kalau saya tunjuk banyak-banyak, tak apa. Yang gambar-gambar lain saya tunjuk dalam exam je lah. Okay, but this is how they look like. So you should at least know this is a normal bursa, how normal bursa look like, then only you know if it's not normal. Control and prevention, proper biosecurity. Okay, proper biosecurity. Number one is basic for any diseases, and vaccination. Okay, time of vaccination, maternally derived antibody, and what are the infecting field strains, and the type of IBDV vaccines. Okay, usually for bursa of IBD, okay, IBD vaccine is one of the most common vaccine that are interfered by maternal derived antibody. Okay, that's why most vaccination was given after 2 weeks, except certain vaccine, a vector vaccine or antigen antibody complex vaccine. So I think I've told you before in the previous lecture, antigen antibody complex vaccine. You already put the vaccine attached with antibody already, and then the antibody will have a lifespan. They will release the antigen slowly. Okay, so and then you can also monitor post-vaccination, flock monitoring program. You take blood, about 20 to 30 samples, serum samples. Okay, check for ELISA if they have the good titer of antibody. And then you can check for histopathology. This is bursa disease, IBD is one of the disease where histology is important. Okay, the chicken, based looking at the grossly of the bursa, looking at grossly of the bursa, kadang susah nak tahu dia besar ke kecil ke, kadang because it based on the size of the chicken. So you need to take the bursa and then do histology. From the histology, then only you see whether the bursa is actually atrophied or not. Tengoklah kat dalam tadi lah macam gambar tadi tu. Okay. And then you can do lesion scoring. I don't have the ruler here. We also have this called bursa ruler. Dia ada satu pembaris panjang macam ni. Dekat pembaris, at the ruler, there's a hole of different sizes. Okay, the hole of different sizes. And then they have a score, 1, 2, 3, 4, 5 of the hole. And then you put the hole at the bursa. You see which hole fits the bursa. Okay, and then you give the scoring, 4, 5 until 7 or like that lah. Okay, certain age of chicken you should have around certain score. Okay, kalau umur macam ni, you should have at least 4 to 5 score. If most of the chickens are around 1 to 2 score, means your bursa is atrophied. I don't have it here. It's in my postmortem box. Okay, it's in my postmortem box. So that's how you do a bursa scoring as well. And then types of vaccine, we do have several types of vaccine. Mild, when you want to develop vaccine, it's quite tricky for IBD also. You want to find the best strain or best strain or virus to develop into vaccine. Okay, sometimes the best strain are the most virulent. However, the most virulent is quite difficult to what they call it, to attenuate, to weaken it, because if you weaken too much, they do not produce antibody at all. They say the body cannot, they do not produce antibody. If you weaken too little, okay, they become the hot strain. The vaccine itself, the virus itself, can cause atrophy of the bursa and immunosuppression. So you have to find a balance. You attenuate, like I said just now. Usually we put in the cell culture ataupun in the eggs, passage sampai dia attenuated. Okay, until they become attenuated. See which passage is the best to use as vaccine. Okay, so it's a bit tricky lah. Okay, this one is, I don't think you need to know lah, type of IBDV vaccine, but it's a lot of IBDV vaccine out there. Okay, thank you. Any question? I think that's all for today. I think it's almost 9 o'clock already. 10 o'clock already. Ada persoalan tak? In anything at all? Okay, saya pun dah kepanasan ni. Okay, if there is none, I think that's all for today. Selamat Hari Raya, bukan Selamat Hari Raya, Selamat Hari Jumaat. Have a good weekend. And if you have any question, just let me know. And class rep, please decide on the test lah when you want to do your test too. And those who scored less than 50%, please come see me whenever you're free. Hopefully this week. because I need to fill up this form. Okay? So, any question? No. Okay. If there is no question, thank you so much. Have a good weekend.
Thank you, Doctor.